Ooh, great, yay. Okay, thank you so much for being here. My name is Amanda Finley. I started COVID-19 Long Haulers discussion group, and we love doing town halls on a variety of subjects related to COVID, long COVID. And I'm excited about this one today about how do we get things into the media? What is that process like? So guests, introduce yourself. Elizabeth, go for it.
Hello, my name is Elizabeth Yuko. I have long COVID. I got sick in March 2020 and never recovered. So I think that probably sounds familiar to a lot of people. I'm a bioethicist. I'm a PhD in bioethics, and I'm a journalist first these days. I write for a variety of publications, but most of my long COVID coverage has been in Rolling Stone.
Thank you so much. And you've been a pleasure to work with. So thank you for all of your great coverage.
Of course.
Miles, go for it.
Yeah, my name is Miles Griffis. My pronouns are he, him, and I live in Los Angeles. I've also had long COVID since early 2020. Um, and I have been reporting on it as a freelancer for a bunch of different publications since then. And then last fall, I co-founded the Sick Times with my colleague Betsy Ladegets, and we're a nonprofit news publication. And we cover the long COVID crisis.
Well, thank you so much. And we'll get more in depth into how the sick times came to be, I hope, later on. But I want to start, I'll field this question to both of you. How does the story start for you?
A long COVID story or a
Or
story?
really any story in general, but a long COVID story with it too, yeah.
I mean, I guess it's pretty similar. I got an idea. Usually it's something to do with my own life. With long COVID, that has absolutely been the case. Um, I didn't tell my family or friends that I had COVID. I live in New York City. I live in Queens, and it was when I got sick, everyone was still in very much in panic mode. And one of the few people I actually told was my editor at Rolling Stone. We've been working together for years. We're quite close. And so I was like, P.S. I got COVID. And I'd been covering COVID for Rolling Stone since February of 2020. And so I was like, you know, those stunt reporters from the early 1900s, like Nellie Bly got herself into an asylum. I guess I'm doing that with COVID. Not funny, terrible, terrible joke. And 4.5 years later, still not funny.
Right.
I went to her in, I think it was June of 2020, and I was like, so the thing is, I'm not better. I'm not better. And we were all given this, like, you will be sick for 2 weeks, you'll be better, you will move on, you can never get COVID again, end of story, timeline. And I was like, there's other people like me. I know. I need to find them, but I know there's more. And you know, there was kind of the early murmurings. Long COVID didn't have a name at that point, and so at that point, I could not get a doctor to believe me, but my Rolling Stone editor believed me, and she was like, "I believe you're sick. Why would you ever make something like that up?" And she gave me my first assignment. I said, I'd like to write about this, and she's like, "Okay, well, obviously it's a developing story, so." You know, good luck. And so that was June 2020 is when I first started reporting on long COVID. The article took me until October to write because my symptoms just kept getting worse. And I had people checking up, like, how's the article doing? Is it coming out? I was like, yeah, unfortunately, I've just had relapse after relapse, and blah, blah, blah. So that was kind of how the first long COVID article happened, when that wasn't really a topic that most people were writing about at the time. And since then, it has just been the different ways that long COVID affects my life and affects the lives of other people, because I'm coming from a place of privilege. I Working has been hard. My income has been absolutely slashed. Like, financially, I'm not in the healthiest position, but I was able to keep my apartment, and I'm extremely grateful for that. But there were definitely months where I'm like, okay, rob Peter to pay Paul type situation. And I knew that I was far from the only person who had economic issues with that as well. So that kind of started looking into economic impact, how I met Amanda. And yeah, I guess it's as more happens to me personally or people I know, more things I have to write about. So there's always more to write about than I have yeses from editors.
Right. I hear you on that. Yeah. And Miles, go for it.
Yeah. I think, yeah, it's similar, like, using your own life has informed a lot of my coverage. Like, I've been reinfected twice with COVID. Um, and there really isn't any information about there wasn't as much information about that, and there still isn't really a guide of what you're supposed to do or what it means. So when I was reinfected in when I say this last wave, I'm like, wait, which one is that? This wave from the winter, in like late December, January. So that was my third infection, second reinfection. And after that experience, I wanted to write about what both of mine have sort of set me back. So I was curious if this was the case with others. So I just started to looking into it, but there wasn't really that much information. There's some studies that sort of at the time were showing reinfections aren't great. A lot more has come out now and show it can increase the risk of long COVID. It can make your symptoms worse. But I wanted to talk to more people. So I put out like a call for, if you've been reinfected, what's your experience like? And I received like 50 emails in a weekend, which is quite a lot for when you do a call. Sometimes you get like one or two or, and everyone's experiences showed sort of just like the difficulties, more disability following reinfections. So that was one story that I inserted myself into because my experience was really timely with that, and there wasn't as much out there. So that was sort of an atypical story, but it was an interesting one to report. Other stories I feel like come from just noticing trends. So if you see like usually when you see something like 3 times, that's when I'm like, okay, this is the time to start writing a story. Like it's one time, okay, maybe that's like a commentary piece or something, and then you see it again. Coincidence, but by 3 times, and then you start reporting, like you can really confirm whether or not it's happening or not.
So what does the editing or the production process look like?
It's different for every story, and is depending on the type of story, who has been interviewed. So for my long COVID stories, and I apologize, there's a siren in the background. You get the full New York experience. I typically interview doctors or some type of expert in the medical or mental health field, and then patient experts, and I frame it that way to editors because patients are experts, but we're not treated as such. So the first time I listed like the experts and then patients. So like, are these all patients also doctors? I'm like, no, they're experts in their own lived experience. And especially with something like long COVID, where there wasn't research and we're all the guinea pigs, we know better than other people. I mean, things are a little bit different now than they were 4 years ago, but especially in the beginning. And so yeah, kind of a mix of different sources, and most publications, including the New York Times at this point, reporters do their own fact checking, and that's the case at Rolling Stone. And so that looks like me going back to doctors or experts I've interviewed with a section of a quote or paraphrasing of something they said, just to ask, like, can you look this over, make sure it's accurate. With people I've interviewed, because I have the recordings, that fact checking process looks kind of like just going back over the reporting, making sure everything and the transcript, everything lines up. When you are reporting with, patient experts, there is always the onus on the reporter to demonstrate that people are who they say they are. So you don't have people saying like, oh yeah, I have long COVID, oh yeah, I lost my home, but then that's not actually true. And that part is one of my least favorite parts, because I hate asking for proof. Like, I'm so sorry, could you send me like a screenshot of your medical chart just to show that you saw the doctor? Okay, so I typically have to provide some type of proof that I can show to an editor, which is then destroyed immediately. So your personal information is not being stored anywhere. It is just for verification purposes. That's especially the case if someone uses a pseudonym, which is something that I was able to offer on some articles to people who didn't want to be identified by their full name, especially one on people losing their jobs because of COVID or not being granted disability accommodations. And, you know, that would definitely not be a place for some people to use their first and last name. So, so it's kind of the verification process. And then as far as editing, it's really like, that's the bulk of it. The rest of it's kind of just standard editing, making sure things read well. Sometimes I'm so enmeshed in the story and I know the people I've interviewed so well that there'll be a part of their story that I may have forgotten to include in a draft, and my editor will say, okay, well, hold on. So how did you end up in a tent? Or, you know, something like that. Just to pull an example out of thin air. You know, something like that. Hold on, let me just go back and, you know, add a sentence just to kind of situate the reader and make sure that I've included everything. So, but that's really the main editing process.
I can laugh at the tent part, so. I was in a tent. So Miles, how does it look for you?
Yeah, very similar. You know, we do our own fact checking at the Sick Times. We occasionally will hire a fact checker on bigger stories. Like my colleague, we hired one for a bigger story that was on the Recover Initiative, just because there was so much to keep track of. So it was helpful to have just an outside eyes beyond us. So we'll do our own fact checking. We usually go through like 2 rounds of edits at the Sick Times and then a final top edit. So usually it's about 3, but sometimes it's more. It just sort of depends on the story. For people who would want to write for us, we have people who submit commentary and reporting. We always just sort of talk about that process. We have people who are, you know, veteran journalists who have written for us, but we also have people who have never written anything or published something before. So we like to just sort of guide them through the process and kind of explain why you do different sets of edits and have someone else edit it after, and just sort of the process of having different eyes on it with different expertise strengthens the story. So yeah, that's sort of how we do those 2 different things. And I just think it just depends on, every story is different. Sometimes I write stories that have fewer edits, and then other times I need a lot more from my colleagues. So it's just, yeah, it's always a process, but I feel like whenever you write a first draft, you're always like, wow, this is so good. And then you get your edits back and you're like, wait, I missed so much. How did this happen again?
So this is something that I've thought about often. What's the difference between different outlets? Is the process of creating a story the same across the board, or does it look different?
It definitely looks different. Yeah. A lot of it has to depends on the relationship that you have with an editor. And this is me speaking as a freelance journalist who writes for multiple outlets. There are some people that I've worked with for years. I know how they work. They know how I work. I can send over 2 or 3 sentences of an idea and they'll know like, yes, okay, that will work for us. Other places it is hours of unpaid work, because as a freelancer, you don't get paid for pitching. And some outlets expect you to have done at least some of the reporting ahead of time, because they don't want questions, they want answer, you know, for as an article that you don't want to just raise questions in a pitch. You have to know how you're going to answer them. And so I try to avoid that as much as possible, just because I work slower than I used to, and I try to cut down on that type of thing. but it also depends on the type of articles that the site or publication runs. Like I recently started writing for health.com, but only a very specific type of article covering newly released research and reports. And so there was a new definition of long COVID that was released back in June, I think, by the National Academy of Sciences and a few other organizations. And so I pitched that, and that fit in with kind of the narrow scope of the types of things I write for them. So that ended up getting approved, but I've subsequently pitched other long COVID studies that have all gotten rejected. So it also depends on what the outlet needs at that particular time, and whether or not they have someone else working on a story. And there's so many different variables that it's easy to look at pitching and think either it's a good idea and I'll get a yes, or it's a bad idea and I'll get a no. But it is not the case at all. It is usually somewhere in the middle.
Yeah. Miles, go for it.
Yeah, I think for me, it all sort of depends like who you're pitching to and who your editor is. Like I found the most success in finding editors, especially like earlier on, who like, and this sounds ridiculous, but like who knew that long COVID was real and like believed people. There was a lot of skepticism, and I think there still is from some editors, and there's bias against this illness because there's still so much stigma. Things are definitely changing a lot more now, but earlier on that was very prevalent. So I found it hard to pitch stories. Like you would pitch a story and you would get a response like, oh, well, this isn't really that big of a deal, or everyone's actually recovering, so it's fine. And it was like, what? You're not reading the same studies I am. Or they would want like a more hopeful spin on something about long COVID. And it just, that wasn't in the reporting that I had done. So it would be like very difficult to sort of find the right people to work with. So I eventually, through time found the right editors who treated the story with the respect it deserved and the urgency that it deserved. But it's one of the reasons that we founded the Sick Times is it's hard pitching stories on long COVID. I still think it is. We do collaborations sometimes, and we pitch some that haven't gone through, but others that have. So it's always sort of a gamble when you're working with someone that you've never worked with, or that maybe hasn't done a long COVID story before. So sometimes you'll see like different inconsistencies across publications, whether how they write long COVID, different style guides, and just sort of like different rigor of each story. I feel like any good long COVID story should have at least one person living with the illness in the story. And even today, there's still stories that, are just experts or something, and it's just medical experts. So it's just different across the board. And I think one editor at a publication might be really great, but the whole publication as a whole might not be great on the illness. It's a total mix. So it's always an interesting field to navigate.
Yeah, and I found a difference just in different media types. Like sometimes I'll get a call like at noon, hey, can you do a story for the local NBC affiliate? I'm like, sure, and they need it now. And you talk for an hour and they maybe air like 3 sentences. So you have to get in a good soundbite. It's a totally different experience, but every bit matters, every story matters. So thank you for the work that you do. Why can it be hard to get coverage?
I think Miles hit on a lot of the reasons. I remember in the early days of long COVID, after the first article I had written for Rolling Stone came out, I started pitching long COVID stories to other publications. And one response I got more than once was, oh, we already did our long COVID story. We already covered it like once. As if it was a box to tick, and like, okay, we did our story on anti-vaxxers, we did our story on masking, we did our story on like story singular. And I was like, oh no, we're gonna be fucked up for the rest of our lives, probably, maybe not, I don't know, I shouldn't be pessimistic, but like this is developing, ongoing, this is not like a one and done, I wish. And so that in the beginning was like, nope, we already did our story. So that's another one. Another thing Miles hit on was people wanting hopeful, happy endings. And maybe this is different for journalists who don't live with long COVID themselves. I have trouble being optimistic. And I have personally improved in the past 4.5, I feel like a lot of us have found ways to mitigate and manage different symptoms, but in a lot of ways, we've lost a lot of people too. It can be very hard to be optimistic and end on a hopeful note. And I think people are sick of COVID in general, just COVID blanket. I've had, again, more than one publication in the past year say, we're done with COVID. We're not covering COVID anymore. Sure, it's endemic, but we're done. Like, we'll run one story saying COVID is now endemic, and then that's it. So we'll cover it like we cover the flu, but not even probably that much. So if people are sick of COVID, they definitely don't want to hear about the more depressing younger sibling long COVID. Right. So like the thing that people want to go away more than anything, COVID, is something that we can't ignore and we can't get away from. And it's like 2 strikes that people, it is such a hard sell. And I mean, I pitched a story about long COVID earlier today, and I haven't gotten a response yet. I'm guessing it'll be no. I made a list. I have published 12 articles with Rolling Stone on long COVID since October 2020. But if I've written 12, I've probably pitched 50. I mean, I maybe even more if I'm just on the phone with my editor, coming up with ideas. Yeah, it's a very hard sell. There's also just this complete misperception that it's rare, that it's a rare disease. I was like, no, it is literally the opposite of rare. Like, no. There are literally millions of us, millions. Like, no, it's not. This is people you probably know. And yeah, so yeah, I'm sorry. I probably don't, that's a pessimistic answer. But yeah, people just don't want to hear about it anymore. And I mean, if there was a new, like a magic pill that could somehow cure every condition and every symptom and everything, and it came out tomorrow, maybe.
Right.
Maybe that will be like interest in that. But I feel like that might even be a tough sell. I don't know, but that's just, but that's why there's such a need for the sick times. Over to you, Miles.
Yeah, I mean, I think a lot of it is there's this clear pandemic like denial at this point. People don't even want to like think about what happened, that we've lost over 1 million Americans to this illness. We have many, many, many millions more now with long COVID and still getting long COVID. So a lot of it is just denial. And I think it's because if you can deny it, or you don't have to think about it, or it's not in the forefront, then you can get back to normal, quote unquote, which I think a lot of the government has sort of pushed us to do. Yeah. And we wrote a story, my colleague wrote a story today with the Sick Times on the 19th. Like our leaders have not even really said the words long COVID very often. I think Biden's maybe said it a few times, 3 times yet. Harris hasn't said it. I don't think we could find a account. Trump, I don't think has said it either. Like it's terrible. I mean, it took Reagan 4 years to say HIV/AIDS. Harris still hasn't even said long COVID, and she's running for it. She's running for president right now. So there's just a lot of denial that comes from economic reasons, policy reasons. And I think that's influenced parts of the media. Like, we will see anytime like there's good news of long COVID, like there was a study, I think like 2-3 months ago, from Ziad Al-Ali and co-authors, and it shows that if you are vaccinated, you are less likely to get long COVID. It like kind of cut it in half to be like a 3 or 4% chance of long COVID. But that's still a really high amount.
Yeah.
And the way that it was reported was like slashes long COVID risk to like almost nothing, or like it was just really, like slashes it in half, like not a concern anymore. So a lot of the times when these good news studies come out that we like and are good news that we're seeing less rates of long COVID, it's reported as if it's completely gone away and we have nothing to worry about. But the
Right.
reality is it's still a really big issue. There's still people getting it. Because some reporting also kind of talks about even long COVID in the past tense as like all these people got sick all these years ago and it's so horrible. We need to help them, but we don't have any treatments right now. But we're also not going to talk about prevention at all,
Right.
because there's still people developing it. So I just think it's denial. I compare it a lot to like climate change denial. I view them really similarly. And that's just sort of the result of economic policy and just all these sort of pressures and sometimes propaganda that has sort of been put on people.
Right? Yeah, nail on the head. And I feel for Ziad. Every time he has a blockbuster study that comes out, people do exactly that. They extrapolate these terms that really don't apply. And he spends all this time saying, no, that's not what it says.
Exactly. Yep.
And with so many competing headlines, what hope do we have for getting long COVID coverage in the news more? I think that's the kicker.
Yeah, it is. I don't have a good answer for that. If I did, I'd be covering long COVID a lot more than I am. But something I forgot to mention in the last answer is two things that dictate coverage, unfortunately, more than everything else, which is advertising money, clicks, that all engagement, all of that, and SEO. And so some editors are only permitted to assign articles that have a certain threshold of search volume. So there are programs people look at to see what words and phrases people are typing into Google, and your coverage has to mirror those concerns. And so never mind that, like, people need to be aware of things to be able to know to search for them. It's like a cycle that's a little broken. So I've also been told, listen, we would love to cover long COVID more. The search value isn't there. And that's really disheartening when it would have been a yes, but because not enough people are searching for what is long COVID, what are long COVID treatment options, etc., that doesn't help. And then, unfortunately, editors are also, especially in digital media, you have to have a certain amount of traffic, a certain number of clicks and engagement and eyeballs on stories. And if one long COVID story I wrote for publication isn't performing as well as other stories, then they now have a reason to say no to me next time and say, well, listen, we did let you write about long COVID in this context. Unfortunately, it didn't perform for us. And so financially, we can't invest in another long COVID article. So I guess if people are looking for something to do to help with it is click, 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 click away. So if you see coverage, don't just look at the headline. If you see it on Google News, actually click on it. That applies to anything you see on the Sick Times, anywhere else. So it's kind of like voting. It just shows that people are interested. And then when I go to pitch another story on long COVID, hopefully it won't be thrown back at me like, sorry.
Oh, you're good.
Quiet phone. Pretty sure it's a political survey. Amazing. So that could help. And I've definitely, I don't as a freelancer, I don't get to see those numbers myself, but I have occasionally been told like this article has actually performed pretty well. And it's been ones that have been shared extensively on social media and within groups and stuff like that. So that does help instead of, because if an editor is going to take it, it's usually like we might try it. We might take a chance and run this story and see how it performs. And then when that happens, I'm like, I'm never writing for them again. Like, I know that it's never going to perform the way that they want it to perform. So that's another thing that's kind of standing in our way, and what makes publications that do run articles on long COVID so important.
Yeah. Well, that was something I spoke, actually, I'm sorry, Miles, before I forget here, no. I spoke with Betsy actually last summer, and just to let you know, Elizabeth, she was like, you're the most optimistic person I've spoken to about long COVID. Like, no, Betsy, there's hope. There's hope.
You are. You really are. You realign me sometimes, and I'm like, duh. Yeah.
Oh my gosh. There's hope. I'm sorry, go for it, Miles.
That's great. No, yeah, I think some things that like can be done. I think like if you see an article you do like, write the journalist or write the editor of the journalist, and be like, I love this coverage and here's why, or this issue isn't being talked about enough. Like that kind of engagement is really helpful. I think we've sort of gotten to the point of like just engaging on social media is helpful, but as all these social media, everything's different, like just everything changes every week, it feels like. Yeah, writing specifically to the publication or commenting on their website and being like, thank you for covering long COVID, it's overlooked or something. Those can be really powerful ways that I think editors might be more aware of, because sometimes when a story does really well, it's just kind of like, great, it did great, but no one really writes in or talks about it. And then the other way, like if there's a bad long COVID story, writing to the journalist or the editor and just sort of saying, hey, I live with this and I don't find this to be true, or I think you minimized the language in this and it's much more important than you've made it out to be. That can really be helpful because it can kind of show the different ways that it's, coverage is good and the ways that it's bad as well.
Yeah, those are great points. Thank you. You all know the assignment now. Go hit those SEOs, go click on the things, and go right to the people. Okay.
But obviously, of course, a lot of people with long COVID don't have a lot of energy, so that can be the work. That can be the work of their able-bodied friends who can support them and advocate for them when they can't. This shouldn't all be on people with long COVID. This should be on all of society.
Exactly. Tag team it, people. What are your experiences on reporting on long COVID?
A little bit of everything, really. I mean, I've gotten messages, like people have emailed me about their own experiences and shared their stories and opened up in a way that I haven't experienced with other topics that I've written about in the past, especially in the beginning when it was so hard to get people to believe us, that when just by writing an article and not just acknowledging that I have long COVID myself, but that I believe it exists, that was so huge back in 2020. I've also gotten a lot of fun, I call it fan mail, but it's really hate mail. It's so funny. It's not funny at all. It's heartbreaking. People love to mention my weight. It's like if they're commenting about how they hate, how COVID doesn't exist, long COVID's all made up, and like, and P.S. you're fat. I'm like, oh, I had no idea. I don't own a mirror or a scale. Like, fuck off. Like, yeah, it's also sometimes extremely emotionally draining when you're speaking to other people, and in some cases reliving experiences that you had maybe earlier or that you're going through at the same time. I had to abandon a story that I was working on long COVID and suicide because I basically went from journalist to subject in that while I was working on it, and I was like, okay, I need to step away from that. I do hope to finish it at some point. But like, yeah, that was not
hard.
It was like, hello, editor. So remember when I pitched that thing? Turns out, so like, it's a fine line between getting the more information that's out there. I feel like that it selfishly benefits me as a person with long COVID, and the more people that believe us and understand what we're living with, the better. But I also have to balance that against my own mental health. And sometimes I do a really terrible job at that, more so than I do a good job at it, if I'm being totally honest. And then then there's the guilt of I need to be doing more. I should be doing more. Okay, I've gotten all these rejections. Nobody wants these stories, but I should be pitching more places. And I also have gotten messages from other people with long COVID who know that I also have long COVID, who have been not so kind, saying you are in a position of privilege and power and you are not using it appropriately. And it makes me feel real shitty. And so I apologize and say I'm really, really sorry. I'm doing the best I can with what I can. And if there's a week when I'm feeling better than another week, then I'll try extra hard that week. But there are a lot of limitations of being a freelance journalist without long COVID. So then kind of adding that on top of that, there's a lot that's out of my control. So, but at the same time, because a lot of the reporting on long COVID is not great, like I'm possessive of it, and I'm like, I will not sleep for 2 weeks. I do not care. I need to be the one to write this, because if I don't know, either no one will write it or someone will write it wrong, and like I don't want more damage to happen than not, and so it's and Miles, I'm sure you have similar experiences with that as well, and so I will stop now. Optimistic, happy. Yeah.
Yeah, I think it's a very emotional topic to cover, especially long COVID deaths or new diagnoses, suicide, all these like very heavy topics. Access issues, people being denied disability, like it is a tough beat to be in, and it encompasses everything. So that has been it's definitely weighs on you, and I agree with Elizabeth. Like I've been wanting to be as good as possible and try and do this, but it's also an impossible task sometimes, because this is an enormous community and enormous illness that is in so many different aspects of our society. So you can't get everything right. People have a lot of different views on what long COVID is, even people with long COVID themselves. So just trying to be as fair and balance as many perspectives as possible is always my goal. And I try to get as right as many times as I can, but I don't always. So it's a challenging thing. I think we've been trying to, at the Sick Times, like also do these social issues, science stories, policy stories. But I've been also trying to include like some art and show like how artists are responding to long COVID, and like different books that are on chronic illness that are coming out, or authors writing about long COVID in different ways. Because I think the arts is a really important way to, as with so many diseases, the AIDS crisis art was such an aspect of it. And I and I know that it already sort of is emerging in long COVID too. So I think those are important things. And then also focusing on like the small wins in long COVID too. There's a lot to celebrate. Like even though some things might not go through, or when we write stories about like a new bill or something, um, these all have long roads to become law. Um, but it's important to sort of look at the wins. And I also like look at wins within the greater COVID conscious community. We've been focusing a lot of stories on like mask blocks and clean air clubs that are really doing like incredible like mutual aid work and stopgap measures in the face of all this government abandonment. So those are really uplifting stories to me because they show people just putting together like community care, centering each other. And a lot of them are led by people with long COVID who are experiencing the illness. So there's I see a lot of hope within it too. And I think eventually those won't have to be stopgap measures, and there'll be hopefully greater protections and um, you know, coming from the government, coming from our leaders.
So if I have a story that I think should be covered, what should I do?
Don't have a great answer for this. Well, actually, so it's hard to tell who's on the staff of a publication versus who is a freelancer who may have written for a publication a lot, because like people are welcome to send me story ideas. I just have such limited power. But if someone is a regular staff writer at a publication and they've covered long COVID before, they might be a good person to reach out to. I guess make sure that you not approve of their previous reporting, but you're on board with it. You like it. It's not, you're not pitching a long COVID denier or something. And also being nice if the person says thank you, I will do my best, and you might not hear from them or ever see your idea, just knowing that there's a lot out of their hands. But yeah, I don't know, Miles, I think you probably are better equipped to handle this one.
Yeah, I think like I mean, you can always email a journalist, sort of tell them your story. We get a lot of sort of more general, this is what's happening to me, like, do you think this is a story, or should this be a story? And even though we are specifically covering long COVID, there's only really two of us that are full-time editor, or not, we're not even full-time there, but we work pretty much full-time. But they like we just don't have the full bandwidth to do every single story. So what I usually recommend is that people pitch their local publications, these more local publications, rather than like a giant publication like the New York Times or a big magazine, are usually more receptive to long COVID stories. And journalists are more curious about it, especially if it's affecting a hospital, or there's a bunch of people who are talking about long COVID in a certain community. And whether or not maybe yours won't fit into a reported story, but pitching like a commentary piece or an op-ed about what you would like to see happen for people with long COVID and associated diseases, that can be really good, because you are then using your own voice, telling your own story, and educating your smaller community, your more local community, and that can spread, I think, that can influence a lot more people, because people really focus a lot on their local news, especially today. So I think, yeah, I think that's usually what we recommend if like we can't take on a story, is going to a local journalist, or pitching an op-ed about what you would like to change for long COVID.
It's not, the answer is probably not text Elizabeth with how do you like these apples, which I think I have literally done.
And that was local publications are a great idea, and letters to the editor also.
Yes.
Those are short, and anyone can write a letter to the editor. You don't have to be a journalist. You don't have to have any writing experience. And if your letter is literally just why, there are people in our community who live with long COVID. Could you cover it more? Or they're like, we're here,
Right.
look at us.
Right.
Or, we exist, or we have this treatment facility at our local hospital, or our hospital's long COVID clinic closed, whatever it is. That, and they're very short. Like, I mean, you've probably written emails longer than letters to the editor. So that is also an option.
Yeah, and if that's something you're interested in, please reach out to me. I can direct you to resources for not just writing a letter to the editor, which is pretty straightforward, but doing an op-ed or doing something else. There are some great writing workshops out there if that's something you've got the spoons for. Let's see. So and I actually reached out, this happened to me about a month ago. I reached out to someone locally who did a story on COVID, but there really wasn't mention of long COVID. So I just emailed this journalist and said, hey, there's mention of long COVID in this. And she was like, let's talk. So that's happening on Monday. So
nice.
You never know.
That's great.
Yeah. So now that I've got this interview, how do I best prepare for an interview?
I think at this point you could give classes on how
to. I have.
I guess don't be nervous. If a journalist is covering long COVID, that usually means they believe you and they are trying to get your message out. And just don't feel like you're in some sort of not competition. It's not like a cross-examination. That's what I'm thinking of.
Yeah.
It's you sharing your story, and you own your story. You don't have to share. If a journalist asks you a question you don't want to answer, you don't have to answer it, or you could answer it in a way that saves some of the doesn't, not lies and don't reveal the whole truth, but you control what information you share with other people. And don't think that just because you agreed to an interview, that means you have to share everything with this journalist. It is still your story, and it's up to you what you want to discuss and don't want to discuss. Go in with notes or bullet points if that helps. As someone with long COVID whose short-term memory is garbage, I will, if I'm having just even a regular phone call that's not necessarily someone interviewing me, I will have bullet points of just things that I want to. I did that earlier talking to my aunt. She was not interviewing me for anything, but I just wanted to make sure I asked her 2 or 3 different things, and I knew that I would forget. That, write down the points you definitely want to make. I like to end my interviews by asking the person, is there anything I didn't ask you about that you wanted to talk about, or anything that you thought of since, or something like that? I'm assuming not everybody does that, but hopefully you'll have the opportunity, at least at the end, to bring up anything that you weren't asked about directly. And if you're not, then just say, hey, actually, there was something else I wanted to mention. And if there's time, bring that up. Those are the big ones. But go in with notes if that helps, but don't feel like you have to prepare and, write out your life story. You are an expert on your life and your experience. Nobody knows that better than you. So although, it can be hard to recall details sometimes, or have something really good and be like, no, I forgot to mention that, which I'm sure I'll do as soon as this call's over. Yeah. And also don't be afraid if a certain type of interview works best for you. Sometimes, different publications have different rules about whether or not an email interview constitutes a regular email interview. And if they do, it usually just means disclosing, like, Amanda told me via email or whatever. But I like to give people with long COVID or other chronic illnesses an option of, we could do a phone interview. We could do a Zoom interview if it makes it easier to see facial expressions. We could do a written email interview, or I could send you a list of questions and you could record voice memos. So you don't have to write anything, and it's like talking, but you could do it on your own time, because who knows when you're going to get energy. Like, you might get a good 15 minutes at 2:30 in the morning, and there's like, I'm not going to take your call at that point. Maybe yours, but that's I know it's serious. So that's another option that I give people. And if a journalist doesn't, if one of those options or a different option would work best for you, don't be afraid to communicate that, because your energy is a finite resource. So yeah, they appreciate that you're using it for the interview.
Yeah, I agree. Always ask for whatever accommodations are best. It's the job of the journalist usually to ask that, but if they don't or overlook it, that's okay. Like, just say, don't risk a worse day of symptoms, post-exertional malaise, etc. Doing a Zoom interview, because that's what they want to do. You can communicate so many other ways. Like, when we communicate, we've done some stories with people with like more severe long COVID and ME, and that's been through email or, other ways. So there's always a way to share your story. And we've also had like other caretakers help conduct interviews, these other things. So there's a way. If you think there's a way, then it can definitely be made into an interview and work. Let's see, what was the question again?
How do I best prepare for
Yes.
for an interview?
Yes. I like Elizabeth's note of like writing down things. I think journalists love a soundbite. Like,
Yes.
So if there's like a message that you want to get through, preparing like a good just sort of quote around it or way to say it can be really helpful. And even saying it multiple times, sometimes it'll really get through to the journalist that this is something that you see as important. And it might help that aspect of your story be shared more easily. I think those are the main things. I think I think the more interviews you do and the more you share your story, the easier it gets. It's always scary the first few times. I mean, I've done interviews where like that I thought we're gonna go on like live TV or like be in segments, and then they never even put them on. And I was so stressed about them. So I think, the more you do, the more experience you'll have. And you can also talk with like a friend the night before or something. They can just sort of ask you just very general questions about your experience or what the journalist is reaching out to talk to you about. But sometimes just, practicing it, what you want to say, can be helpful.
Yeah, and I'm totally on board with writing it down, but make bulleted points. Don't write out, because
Right.
when you're in the moment, you're not going to read all that. Even after the moment, you're not going to read all that.
Exactly.
Just bullet it and make it easy for yourself. I did a live interview with CNN from my bed. It didn't really hit me until later. Oh, that was in my bed. That's great. So what if there's a mistake in a story? How can that be rectified?
I guess the first thing you can do is contact the journalist. And I guess also, to back up for a second, mistake is it's hard. Because some, like, spelling someone's name incorrectly is one thing, but if you what's a good way of saying this? Some people will see sentences that aren't in agreement with their own opinion and call them a mistake. Um, and this is not something that I dealt with as much in the very beginning of my career, but it's very much a thing now. And or I mean, I some of them they're not funny, but some people are like, oh, there was an error in your article. You mentioned long COVID, and that does not exist.
No, well,
False.
I shall fix that.
Right, exactly. I'm like, oh my God, I'm cured. Amazing, thanks. So yes, but if there's something like a factual error or someone misinterpreted a study or something like that, kindly, always be polite. That's just a good thing in general. You can contact the journalist if you're able to find their contact information, or the newsroom. You could check like Google the masthead of a publication to see if they have like a general news tips email, or if you're able to identify which editor was in charge of that section. And just without making it as brief and concise as possible, point out what the mistake is and how to rectify it, or who to contact to rectify it. If you send a long diatribe about why something is wrong, even if it is wrong, someone doesn't want to read that, and they probably will think that they might not take you seriously. But I mean, but if there is like an actual error in someone's reporting, certainly feel free to get in touch. It is hard to find people's contact information sometimes. I struggle with that as someone who's been in this field for a while, and especially now that Twitter's not what it used to be. It's much harder to track people down. But yeah, if you see something that you know is incorrect, don't be afraid to flag it.
Yeah.
Yeah, great advice. Just yeah, keeping it concise. If you can offer like a citation of why it's wrong, like maybe they say long COVID affects hundreds of thousands of people. Be like, actually, yeah, I quote that line, be like, here's the source, and then be like, long COVID actually affects 400 million people. Here's the study, Ziad Ali et al. Here's a link to the study. You can find that information in the abstract. Thank you. You know, that could be helpful, like giving the really specific of like why it's wrong, because a lot of these editors will be pressed for time, and if they can just quickly see that that is wrong, they'll be more likely to issue a citation. And I've learned a lot of this from like writing long retraction letters to publications from long COVID deniers. It's much easier to be concise rather than long.
Yeah, right. Well, we'll get to our last question here. I'm so frustrated with most politicians and their lack of knowledge of long COVID. How do we get them to hear us? Specifically, how do we get presidential candidates to listen to and talk about this? How do we get the CDC to do the same?
Great questions. I mean, once upon a time, I was a local reporter at a local newspaper and actually attended press conferences where the county commissioners would take questions from the press, and we were all in the same room and I could raise my hand and ask a question. And so I guess if I was in that scenario today, which unfortunately I'm not, I could raise my hand and ask like, what is the county doing, or what is whatever the political group doing. So we can encourage journalists who do cover places like the White House, people in the White House press corps, to ask questions about that. But at the same time, they're also swamped and also can only cover certain things. So it's yeah, it is really hard. I mean, Amanda, I think you have more success than anyone I know getting attention from people within the political sphere. CDC is tricky because, during the Trump administration, it was extremely tricky. And I was told a lot of things off the record, just as far as people who were put in positions that did not have the experience to be there. higher ranking positions within the CDC, and it was political, and like there was, I mean, it was very intentionally political, and so like that was really difficult. That was almost easier to deal with. But when you have like the guidelines more recently, within the past year or two, of like, oh, don't bother testing, don't bother isolating if you have COVID, don't worry, don't worry. It's the same as a cold or the flu, whatever, no big deal. Like that, like makes my blood boil. And that is because I spent years and lots of virtual ink defending, like, we need to follow CDC protocol and stuff, and then they go and like betray us. So that is really, really difficult, and I don't know how to change that, because certainly there are people working within the organization who know that these guidelines are bullshit.
Right.
They can't say anything because then they might lose their job. And so I acknowledge that these are all big questions, and I really wish I had a better way to tackle these things. But I mean, I guess if I wanted to get in touch with a politician, I would ask Amanda. That's not.
I actually got an email just before we got on, like, oh yeah, hold on.
But I mean, like, you have had success with what, like, cold messaging politicians. What do you know about long COVID? What are you doing about long COVID? And you've got, made headway with that. And so that if someone wants to do something, then that's one way to use your time in a productive way.
Guerrilla advocacy, that's what it is. One person at a time, just ding, ding, ding. I would go through Twitter, one person at a time, like, what do you know about long COVID? And I wouldn't give them a long diatribe, no wall of text, just what do you know about long COVID? I think my favorite was a state representative from Northern Georgia who fired right back with not enough. And I was like, oh, let's talk.
That's great.
Yeah.
Yeah, I don't have a perfect solution for this either. I think my colleague Betsy was reporting on the Harris campaign and their possible response to long COVID, since Tim Walz has put together some programs for long COVID. Mm-hmm. We did not receive any response from the Harris campaign. We also reached out to their disability engagement person. I don't know. Mm-hmm. I forget what the title is. I mean, her name is Anastasia. Didn't receive a response, or didn't receive a comment from her. I think reaching out to people specifically like in that type of role of a disability engagement could be very useful for these campaigns, because they are the ones that are supposed to be engaging with the disability community, and the long COVID community is a large part of that. So yeah, like targeting these more specific people who should have more knowledge of long COVID and what it is. But yeah, I was very disappointed that they didn't even engage with us or give a comment on a very large issue that is a part of the disability in America right now. Yeah, I've seen advocates try so many different ways, and journalists try different ways to get in touch with different people. The CDC is really hard to get in touch with. We've had more success with the NIH, has been more willing to talk to us. Mm-hmm. So yeah, if anyone has any, honestly, if anyone else has any tips of how to get in touch with these people, we're also interested.
Yeah, that really, you're right with that. It's about targeting your advocacy, targeting what you're doing to a single person. That has been what's been most effective for me. It's time consuming. It uses a lot of spoons, but there are 400 million of us. We can break this down. So.
Yeah, and I think maybe it's like, I think other advocates have had success talking with like different senator and like representative like, what are their, I forget what their titles would be, but like their chief of staff or whatever, developing like relationships with them and really sharing your story over time can be a lot more effective
Yeah.
than just making, like one call. And sometimes I feel like they just log it and move on. But if you're sort of more in their face, and that can likely have more of an effect.
I was kind of surprised by Josh Hawley's health aide. We met several years ago. He was a great guy. I mean, it wasn't going anywhere, but he was a great guy. But any final thoughts? Anything we didn't cover that you wanted to say? Yeah, I'm
I
gonna put it back on you.
I think the only one I have is, and maybe this is like the way also an answer of like how to get long COVID more in the news, is just continue sharing your story, local places, with friends, with your doctor, with politicians, just anyone and everywhere. I think that is a really powerful way. And the more people that actually are aware of long COVID will be able to come out with their own long COVID stories. Because I feel like a lot of people are affected and might not fully know it or want to talk about it because of the stigma around it.
That's absolutely true. And by talking about it, even if it's just, I guess, to take an example from my own life, I had to cancel plans recently with somebody that I didn't know very well. And I just said, I have long COVID. I am in the midst of a little mini relapse. I am running a fever today, and I'm really sorry I won't be able to make it out tonight. And even little things like that, just to normalize the fact that we're talking about this because it affects so many people. Like we would talk about other conditions. Just dropping into converstion where it makes sense.
Yeah.
Not necessarily like in the grocery store or whatever, but
Well, I do that.
I mean, but no, Miles is totally right. Is sharing your story and normalizing it. And I don't do it as much as I did in the beginning when it was really so many people were like, you're the only person I know with long COVID. I'm like, that's probably incorrect, but I just am the one who said something about it, and it has made a difference. People have said like, oh, I didn't, because I didn't know anybody, it didn't seem real, but now I know you and now it feels real. And so and then maybe they will go to work and be more empathetic to a coworker who has long COVID. And the more we talk about it and just get people to understand that this is something that affects so many of us every single day, the better.
I actually printed up business cards. I had stopped driving 3 years ago because of long COVID. Every single Uber, every single time, we're going to talk about COVID. And here's my card. And it's like advocacy confetti all over Kansas City. But it has the Brookline number, the long COVID support line number on it. And inevitably, either the driver has long COVID, someone in their family has long COVID, someone they know has long COVID. We just need to talk about it. So,
yep.
Yeah, well, thank you so much for this great conversation. It was a pleasure seeing both of you. We will catch you on the flip, okay?
Thanks for having us on.
Thank
you.
you.
Bye.
Bye.